And thank you to everybody for joining us this evening for Lupus Canada's self-advocacy webinar. It's our last one of 2021, so we're excited to have everyone here. Tonight's topic is mental health and lupus, managing expectations during the holiday season, which we thought was such a relevant topic for this month. Our presenter is Janice LeBlanc. Some of you may remember Janice as she was our host presenter for our mental health and lupus webinar back in April. With over 20 years clinical experience, Janice is a registered psychotherapist, registered art therapist, certified trauma and resilience specialist, and an EMDR therapist. I just want to give a few housekeeping items to address before we begin. Please note that all attendees will be placed in listen-only mode, which means audio and visual will be disabled. If you have a question as we're moving through the presentation, please post it in the chat box and we will do our best to address it as we move along, or there will also be opportunities at the end of the presentation. We hope you find this webinar very informative. I will now pass this over to Ariana Ranjabar, who is our moderator for this evening's webinar. Ariana?
Thanks, Leanne. I would just like to reiterate that I'll be the moderator for tonight's webinar. We'll be doing the Q&A once Janice has done her presentation. Should you have any questions during the webinar, please post it in the chat box and I'll do my best to communicate them with Janice. I will now pass it along to Janice. Thank you so much for joining us tonight.
Thank you. Thank you for that introduction. I'm just going to share my screen here. And thank you to Lupus Canada for inviting me to talk again. Just let that load. There we go. All right, so I'm here tonight to talk a little bit about lupus and dealing with holiday stress. That's me. That's me. Just a clarification or disclaimer that the information that I'll present tonight is for educational and information purposes only. Assessment and diagnosis of a mental health disorder can only be done by a mental health professional and or a physician. So we don't want anyone leaving this talk tonight and trying to self-diagnose. So an outline for tonight of where we're headed. I'm going to talk a little bit about the symptoms of lupus and mental health. We're going to look a little bit at stress, cumulative stress, and where we are on the stress continuum. Then more specifically, talk a little bit about holiday stress. And then I'd like to spend most of the time tonight on different ways to manage holiday stress. And a lot of the strategies and things that I'll talk about can also be applied to any time of the year when there's celebrations or even really just in daily life managing stress. Oops. Oh, we're frozen. My screen has frozen. But what I'll do is give it a minute and we'll just go into a calm place visualization to start the talk. And then after, Ariane, I may need you to run it. I'm not sure why it's not forwarding. Anyway, so what I'd like to do is to just do a very brief visualization that demonstrates some things that we can do to manage stress. So if possible, if you can detach from any phones or any other screens for the next little while and begin by sitting in a comfortable, relaxed, upright position. And if it's for you, just close your eyes. And if not, just focus on one point in the room. Just bring your awareness to your feet, grounded on the floor, into your sitting bones on the chair. You have nowhere else to be and there's nothing else to do right now. No to-do list, no concerns. Give yourself permission to take this time for you and that you're worth taking the time to take care of yourself and nobody else right now. Bring your attention to your lower back.
Janice, I think you muted yourself.
did that. Sorry about that.
No worries.
You just had us in a very relaxed state.
Okay, no one noticed. Okay. So just encourage your areas of your jaw to soften. Bring attention to your heart area, allowing that area to be spacious. And just notice and be curious about any tension in your physical body and how you're feeling in your emotional body. Breathe in and just notice, not attaching to any thoughts or feelings, just letting them float by like clouds in the sky. As you breathe in, inhale calm and relaxation. And as you breathe out, just allow any negative thoughts to leave your mind and body. As you breathe, allow yourself to picture in your mind's eye a calm and peaceful place. It can be real or imaginary, or from a book or from a movie. What's the first place that comes to mind? What type of place does your mind choose? Picture a place that feels calm and serene and safe, a place you feel safe and protected. Imagine the details of what's around you. Notice what you see. What colors do you see? What textures? Notice what you hear. What smells do you notice? And what does this place feel like on your skin? Is it warm? Is it cool? Just allow yourself to take in all the senses, feeling calm and peaceful. In that calm place, just allow yourself to feel the ground beneath your feet. Notice the gentle earth below warming you and supporting you, allowing you to relax even more and feel calm and peaceful during this time. Feel your body releasing any tension into the ground, letting it seep away. Notice as you become part, you feel more rested, more relaxed, more at peace. And just continue to slowly breathe in and out. After you've thoroughly visualized this place and you're ready to leave for now, allow yourself to come back to the screen. Leave your calm place for now, knowing that you can return to it anytime you like. Just wiggle your fingers and toes. Open your eyes if they were closed, but try to stay in a relaxed position, taking a moment to reawaken completely. So that's an example of a visualization as a strategy that actually combines a number of different ways that we can handle stress that I'll talk a little bit about later in the talk. So now I just want to talk a little bit about lupus and mental health. As Leanne mentioned, I did an entire hour on this back in April, and it is still on the website. I'm just going to touch on a few key points here tonight. But if you want to refer back to that, it is still on the website. So just looking at the overall symptoms of lupus, there's a variety of symptoms that span the spectrum in intensity and duration. And a lot of people with lupus will present very differently than other people with lupus. So some of the general symptoms can be chronic pain, especially in muscles and joints, extreme fatigue, sleep issues, lack of concentration or focus, memory issues and brain fog, rashes, fever, hair loss, chest pain, anemia, kidney problems, sunlight sensitivity. So the symptoms can really run the gamut and can be quite different and debilitating for many. These symptoms, of course, can then impact self-esteem and self-image, can impact employment, about how many hours people can work, the type of work they can do, whether they can work at all, if the symptoms are quite impactful, which then, of course, influences finances, how much income people can make. It can also influence and affect activities they can participate in. It can affect relationships in terms of human connection. Can they see people? Can they be around people? And can absolutely impact people's future in general in terms of really living the life that they want to live. So when we look at the mental health symptoms of people with lupus, often there's an overlap with the actual symptoms of the disorder itself. So in terms of dealing with the healthcare system, doctors really need to be looking at mental health and physical health when they're treating patients with lupus. So some of the mental health symptoms that can come up are social isolation, sleep disturbances, difficulty concentrating, feelings of low self-esteem and self-worth, anxiety, depression, feelings of hopelessness that things won't get better, strained personal relationships, again, impacts on employment, and anxiety and depression may actually present at clinical levels. But if you look at the symptoms of lupus itself and you look at some of the mental health symptoms, there's definitely an overlap. And one of the goals when working with your primary health team is to really tease out what's the mental health piece and what's the lupus piece, which can be very challenging. So when we look at the different feelings that result from having lupus, there are quite a number that can arise. So things like frustration and anger, and that can be around the diagnosis. It can be around other people not understanding. It can be around limitations around work and social events or social interaction. It can be frustration and anger dealing with the medical system that may not understand or provide the level of relief that people are wanting and needing. There can also be feelings of grief around losses around personal freedoms, around losing social connections and again, relationships, grief around independence, not being able to do everything that people would like to do, grief around a sense of a positive future. There can also be feelings of embarrassment and shame about how one's feeling or looking. There can be anxiety around the unpredictability of what might happen next. The unpredictability of every day is different. People with lupus will feel different on different days, and that unpredictability can cause a lot of anxiety. Anxiety around employment, around family, around health, and around, again, independence. And then lastly, some sadness and depression. So feelings of sadness around these different losses, around relationships and connections or isolation, sadness and depression around negative feelings around the self, and grief over losses of what was and really what will happen in the future. There may be a lot of other feelings that come up as well. These are just some of the main ones. So when we look at the clinical diagnosis of a mental health issue, sometimes the mental health piece, like I mentioned, is missed by doctors as they focus on the physical symptoms of lupus. So really the mental health needs to be looked at in the overall treatment plan. We do know that depression and anxiety are the most common comorbid mental health conditions, meaning people with lupus, those are the two that present the most in terms of clinical levels of mental health issues. And sometimes there can be depression and anxiety that may also come as side effects from medication. So again, these are important to talk to your doctor about. So just briefly, I'd like to just mention the symptoms of depression and anxiety. So the symptoms of depression, when we look at a diagnosis of clinical depression, it's meeting certain criteria that have been present for 2 weeks or more, almost all day, every day. So we're not talking about regular sadness that comes up in everyone's life. We're talking about sadness and some other symptoms that are there all day, every day for at least a couple of weeks. So some of the criteria are sadness throughout the day, nearly every day, a loss of interest in doing things that you once enjoyed, feeling worthless and feeling irritable, having a lot of fatigue or lack of energy that is not from another cause. So this would not be necessarily from lupus, but it would be just that general, I don't have any energy. Aches and pains, sleeping too much or too little, change in appetite or weight, and thoughts of death or suicide. meeting some of those criteria would put you in the range of being clinically depressed. Now, a subcategory of depression is something called, excuse me, something called seasonal affect disorder, or SAD, which is a type of clinical depression that is cyclical in nature. So it occurs in the darker months of the year, so fall through the winter, and it usually comes up every year at that time. And people who have seasonal affect disorder, that level of depression will really lift in the spring into the summer. And the suspected cause is from the decrease in the level of sunlight in the fall or winter, even in especially in northern climates. We have studies that show that. And what happens is the lack of sunlight actually impacts the level of serotonin and dopamine in the brain, and those are the two neurotransmitters that really impact our mood. The rest of the symptoms for seasonal affect disorder are the same as clinical depression. It's just we have that additional piece of it being a definite cyclical thing. The treatment, two main treatments are medication and psychotherapy, which we also use for the treatment of clinical depression. The treatment of seasonal affect disorder, we add in light therapy. Now, for some lupus patients, that's not suitable if they have sunlight sensitivity. So that light therapy, we don't want anyone going out and buying a light. You can get them quite readily, but you want to check with your healthcare provider to make sure this is suitable for you. But that's the main treatment, is for 20 to 30 minutes in the morning, to have a light shining at a certain angle at the retina. And I do have clients that use the light and that are suitable for them to use. And it does make a big difference. And it's usually just for those few months when we have really very little sunlight. So when we look at a clinical diagnosis of anxiety, again, it's beyond nervousness, and it reaches a clinical level when this is all day, every day. And that level of nervousness really interrupts functioning. People can't function because they're so incredibly anxious. So that includes excessive worrying, those ruminating thoughts, being on that hamster wheel, thinking and thinking and thinking and thinking, having difficulty sleeping, being very restless, as a result, having a lot of fatigue. Concentration issues can come up, irritability and tension. There can be a lot of physical symptoms, which I'm going to talk about. The heart racing, trembling, shaking, sweating, being very hot, aches and pains, shortness of breath, digestive issues, and feelings of impending doom or terror. So there's a lot of physical things that come up with anxiety, and they can be quite different in different people as well. So when to consider that something is a mental health issue versus regular emotion, there's two main criteria. One is that they're long lasting, so it goes on and on and on, and it interrupts functioning. So you can't go to work, you can't go to school, you're too nervous to attend any social functions at all. We're not talking about regular, I'm a little nervous because I have to give this talk tonight. We're not talking about a little bit of sadness because we heard something sad on the news. We're talking about this really impacts people and they cannot function, they want to function. And if that kind of fits you, then you really need to speak to a mental health professional or a doctor, a medical doctor, to find out what's happening. So I just want to spend a few minutes talking about stress. We all have stress. Stress is very normal in life. Some people have more stress than others. Some people handle stress better than others. It can be a positive thing. It can get us motivated. It can help us meet deadlines. It can help us achieve. But we get into trouble when it's too much and we're overloaded and we can't handle it, which I'm going to get into. And people who have a lot of stress, they often describe it as too much. There's too much going on. There's too much for me to do, too much for me to cope with. So most of you are very familiar with, but I thought I'd put them in here anyway. So we have signs and symptoms of stress. We have cognitive, which is our thoughts and what's going on in the brain. We have emotional, and we have behavioral. So in the brain, we have a hard time concentrating. We have a hard time thinking. With sometimes negative thinking will come, we make decisions. Emotionally, we're very irritable. We feel hopeless. Can be some anxiety and depression when we're stressed, and feeling agitated or kind of keyed up. And behavioral, how do we behave? What are the things we do? Often we neglect family and work. We increase use of substances. We may withdraw. We may socially isolate because it's just too much. We can't deal with it. We also want to look at the body's response, and this is what we really need to pay attention to in terms of managing what's happening in terms of our stress levels. So there's a little part of our brain called the amygdala. It's way in the center of the brain. It's a very um, primitive part of the brain, very small, and it really is our smoke alarm. So it's the thing in our brain that is constantly scanning our environment for danger. It will respond to real danger, but it will also respond to memories or perceived danger. So it could be something like, an example is if you have a smoke detector over your dishwasher and you open that dishwasher and steam comes out, it's really not that harmful, but the amygdala feels that steam and it still would send out a signal. Okay. And when it sends out the signal, that's when we go into freeze, flight or fight or freeze response. So we either stay in the situation and we fight, or we flee to escape the situation, or we also freeze. So there's a third one now. A lot of people have heard of fight or flight, but now there's a freeze response. We know that people just freeze it in place and allows us to kind of stop and protect ourselves. But what happens when the amygdala goes off, that smoke detector is going off, it basically activates the entire system in order to either fight or flee. It shuts down digestion. So a lot of times people when they're stressed they'll feel nauseous, or when they're anxious they'll feel nauseous, and that's because digestion has shut down. Our heart rate will increase, our breathing will increase, our pupils will dilate because we're constantly scanning. So there's a whole physical response that happens when we're in this state. The difficulty when the amygdala is going off, it's a great little system because it protects us and helps us be safe. The problem is the rational brain goes completely offline. It's not working at all. So when you hear people when they're really stressed, they can't remember anything. I couldn't think straight. I couldn't make a decision. I really don't remember what actually happened. That's because that rational brain, prefrontal cortex, is not working because all the energy in the entire system is being controlled by the amygdala, and the amygdala is helping the person, helping us fight or flee or freeze. And therefore, the rational brain, we can't have any energy going there. So we also want to look at cumulative stress. So we have basic stress in life, etc., but cumulative stress can be quite dangerous and risky. And it's defined as being prolonged chronic exposure to stress. So this can lead to physical disorders, heart attacks, diabetes, all kinds of other high blood pressure is all related to this, and also psychological or mental health issues. So we want to be, looking at our stress level and keeping it at a manageable level, because if it becomes very cumulative, that's when we get into that danger zone. And this is sort of just a nice graphic to really look at where are we sitting right now. So we want to stay in the green and yellow zone, which is, we're good to go. We may have a bit of stress, but we're managing it. We're feeling okay. Into the yellow, a little bit, a little anxious, a little irritable, some behavior changes, but we want to stay out of the injured and ill. In the orange and red, we want to stay out of that area. So if you're looking at this thinking, oh, okay, I'm maybe in the orange and the red, I'm at that point, you may need some extra support around that to help manage some of that stress that's going on. So let's take some time to look at the holiday stressors. There's lots of them. So I've written some here. I don't know if you'd like to put in the chat, have a poll question, any other stressors that I haven't mentioned that you may want to, that I haven't thought of, but there's many. So we have financial stressors, the costs of gifts, decorations, food, if we have to travel anywhere. A lot of money is spent over the holidays, and that can cause a lot of stress. Meals, either planning meals, you might have relatives who don't eat certain things, they're vegetarian, or they don't have gluten or other dietary restrictions. So even planning can be stressful. Shopping for food, of course, can be stressful. Making the food, eating the food. If you're going somewhere and you don't eat certain things, is there going to be enough for you to eat? There's a lot of stress around meal stuff. Family can cause a lot of stress during this time of year. They can cause a lot of stress at other times of the year. But at the holidays, a lot of the dynamics in the families, especially if there is some dysfunction, will really rise to the surface. So if people are divorced or separated, or they don't have family, or they've lost family, and this may be an anniversary around a holiday when that loved one is not around. So family can cause a lot of stress. Um, Activities, too many people, crowds, maybe not enough activity, feeling lonely as well. Travel can be exhausting, not just the expense, but the arranging and the doing all of it to visit family. Where are you going to stay? How are you going to stay? How many people are going to be there? The shopping and the errands, the spending of the money, the crowds, the physical demands of, either going to the mall or going to look for gifts, meals, etc., can be quite stressful. Also, religious demands or celebrations or obligations, those can add some stress to people, and trying to stay healthy. So obviously during, we're still in COVID, trying to stay away from people, trying to stay healthy, even just colds, flus. So I'm wondering if there's any other things that cause you stress that I didn't mention during the holidays. Not that we want more.
I know you covered so many. No one has said anything quite yet.
We can also circle back at the end if anyone has any others.
Oh, someone just said commuting in traffic.
Oh, yeah. Yeah, that's a good one.
Sometimes I find the weather, especially like if it's
Yeah.
icy, super windy, can be a stressor.
Mm-hmm.
Lack of access to healthcare.
Oh, yeah. Yeah, those are good ones.
I think that's it for now.
Okay. We can always come back.
Yeah.
So spend some time on looking at stress management, a way you can improve the quality of your life during the holidays, or again, really anytime. These apply to always. So when we're looking at a wellness plan, we want to include strategies that address the physical, the emotional, including our thoughts, the social, the spiritual, and the personal, including work, creativity, and hobbies. And these are some categories when you're looking at, because often we tend to take care of one or two or three areas and we may neglect others. So these are just some reminders of different ways you can tweak things. So we always start by looking at the physiological and lifestyle changes. So things like diet and nutrition, water and hydration. How much water are you drinking every day? Looking at sugar and caffeine and noting how much you're taking in. Looking at your social media, how much are you spending on screens? How much are you spending on social media? And that subtle sort of underlying always comparing to other people. Looking at the amount of exercise you might be getting, maybe including a bit of yoga, a little gentle walking. Again, it's whatever you can manage and what is healthy for you. And always consulting your doctor about things like exercise, and avoiding mood altering substances like alcohol, drugs, and tobacco. Getting outside, it's cold and it's gray and it's dark and, not so nice lately. But ask yourself, how much fresh air are you getting in a day? So even walking around the block, if you can manage it for 10 or 15 minutes. And again, focusing on the senses, just like we did it in picturing a calm place at the beginning, is to really take note of what you're seeing, what you're hearing, smelling, how it feels on your skin, really noticing your environment, which again helps us be mindful of what we're doing. And again, helps us gain some vitamin D. And again, if you have issues with light sensitivity, then again, this should be discussed with your doctor, how much time you're outside, or with appropriate clothing. Looking at our sleep, I think we are chronically sleep deprived. I think 95% of the clients I work with have difficulty either falling asleep or staying asleep. So these are just some small suggestions. Being in a very dark, cool room can help our sleep. Not doing any work in bed, going to bed at the same time and getting up at the same time every day when possible. It helps us, really have a predictable sleep cycle. Not napping, because naps will interrupt our sleep cycle. trying to wind down for at least an hour before bed, and no blue light before bed. That includes phones and tablets and readers and all of that. Having a warm drink if you're having difficulty sleeping, or warm bath. Scents like lavender and vanilla can be relaxing, calming music or nature sounds as well. So just a few things to kind of look at to see even if you're having difficulty sleeping. Looking at different relaxation techniques. So we want to always calm that amygdala, because it's the amygdala that's kicking up when we feel stressed. So deep breathing, there's a reason that deep breathing works. What happens is we have something called the vagus nerve that goes from below our diaphragm right up into our brain, into the back of our brain. And when we have very slow, long, deep inhalations and exhalations, that vagus nerve sends a signal up to the amygdala that everything's okay, that we're calm, we're fine, we're safe. And then the amygdala calms down and just goes back to sleep. So when we tell people to take a deep breath, just breathe through it, there's a reason for that, because that vagus nerve is activated and calms the amygdala down. So guided imagery can also help, like we did at the beginning, adding in a little bit of breathing in that. Different apps there's tons of apps out there that have guided imagery, that have music, all kinds of things. And I have a list in another slide. Or journal and write down how you're feeling to get rid of it, to get it out, to get that stress out of your body. Gratitude. Mindfulness has been shown to decrease symptoms of depression and anxiety quite significantly. And we have a lot of clinical studies to show that. It's very challenging to do, and it needs to be practiced, because the human brain is usually thinking about looking forward to tomorrow, the next hour, the next day, the next week, the next year, or looking back. We are rarely in the moment right now. So mindfulness is really about noticing and stopping and paying attention and focusing on the present moment, and not comparing yesterday or not thinking about tomorrow. It's really, what can I do right now, today, to reduce this stress? It's challenging to do, but it's worth it if you practice it. This is a number of mind calming apps that either I've used or I've had clients report back on. Most of them have a free version, and they're quite good. So there are different breathing exercises. There's all kinds of different things. A lot of people are familiar with these anyway. So calming the body, again, using grounding, using the senses. So again, in that visualization, I had you use all your senses. 5, 4, 3, 2, 1 is a really handy one. So you start with, what are 5 things I can see? What are 4 things I can hear? What are 3 things I can smell? 2 things I can touch? 1 thing I can taste? And what that does is, when you're really anxious or you're stressed, it shifts your mind into thinking about something else, because the brain cannot really think about 2 things at once. So it shifts that focus. Progressive muscle relaxation really is about tensing up groups of muscles and then letting them go. And there's a really nice YouTube video there I've listed. Doing deep breathing, again, calming music or apps, and practicing mindfulness, which I mentioned. Just a little bit more about visualization. A nice visualization to start your day is right when you wake up, to really visualize, how do I want my day to be? So even if it doesn't work out like that, you started in a calm place. And how will you remain calm, relaxed during the day? And how can you plan a few moments to calm as the day goes on? Creative pursuits. I'm an art therapist. I'm an artist. I do a lot of art, so I firmly believe in it. When we do creative activities, it accesses a different part of the brain. So it can be art, music, drama, cooking, knitting, crocheting, or whatever you do that you think is a creative. Gardening, when we have nice weather, can really help reduce stress. Self-talk is very important, especially if people are feeling some anxiety and depression. So feelings of anger and sadness can bring up unproductive thoughts. So things like, this isn't fair, I haven't done anything wrong, so why do I have these health issues? Why me? Why am I'm a burden to my family and friends during the holidays. I can't do all these things that I want to do. Do the things I want to do them because of my illness. So this is very negative stuff that can come up in the brain. It's very legit. We need to validate it. However, we also need to challenge it, because we don't want to stay there. So these are normal thoughts and feelings that are going to come up, but you want to ask yourself, where's the evidence for this? Where's the evidence that I'm a burden? Where is the evidence? Because usually there isn't any. And the other really useful, excuse me, useful phrase is, or useful question is this useful? Is it useful for me to think about this for hours on end? Probably not. So those two little questions can really stop that ruminating and that stress and can bring about more balanced feeling. I use them. I have my clients use them. Quite useful. Looking at what you can control and what is beyond your control is a very important exercise. And this is just two circles. I encourage people to do it on paper. On the inner circle is what I can control, outer circle, what I can't control. Because usually when we really look at it and sort of analyze it, most of our frustration and upset comes from things that we cannot control. So when we write them down, then we focus on what we can control. We focus on that inner circle. Helps give perspective. Developing a positive support system. I think people do this naturally, but really looking at who is in your world. You want people that are strong and positive, like family, friends, doctors, specialists, natural remedy doctors, mental health professionals, faith-based supports. Who can you depend on, especially in the holidays or at any time when there's difficulties? Who can you depend on for support? So really looking at the holidays, planning is key. So using lists or calendars on a whiteboard or paper calendar in a phone, post-it notes, whatever, but using things to sort of remind you and keep track of maybe what needs to be done or when you're going to do it. So it can also include a calendar, a schedule of when perhaps I'm going to get certain things done that I want to get done. And delegating, sometimes we want to do everything ourselves when most people are happy to help and contribute, but they don't know that. And we need to ask that. We want to schedule in self-care in that calendar and also be very gentle with yourself if the plan has to change because you're maybe not feeling up to doing everything you thought you were going to do. It's okay to take care of yourself first. Expectations. This is huge. This is a really important thing to look at. A lot of holiday stress comes from expectations and trying to make things perfect. And you want to ask yourself some key questions like, what do you expect of yourself? Are you gentle or hard on yourself? And do you have a tendency towards perfectionism? And then what do others expect from you? And are these expectations accurate and true? Or are you doing a little bit of mind reading or jumping to conclusions? We might think, well, my family expects me to do a 12-course meal on this certain holiday, where other people are thinking, no, we don't have to have a 12-course meal. But we haven't really communicated and asked that question or had that discussion. And then really looking at, are these expectations realistic or unrealistic? And if they're unrealistic, then we need to look at tweaking them, adjusting them, changing them somehow. Which leads to setting clear boundaries. So often boundaries are crossed because we don't want to speak up or we're really not clear ourselves what we really want. So you want to consider things like time that you're able to spend at a certain function. What are you able to do for a function in terms of preparing, contributing? What are you able to spend on the holidays? That comes around the financial stress. And how much are you able to take on? So you may be willing to do a lot of these things, but what are you really and truly able to do to keep yourself well? And then it's important to communicate your needs, your boundaries to family and friends because they can't read your mind. We do a lot of mind reading and it just doesn't work. So you want to set limits on time, money, activities that you can manage. You want to be clear about what you want to do, what you can and cannot do, using iMessages to really express how you're feeling about things. And I've just listed some helpful phrases here in terms of what you're willing or not willing to do or able to do. So things like, what works for me is at this time I'm able to. This year I'll be doing a buffet and I would love if you can contribute something like, be specific. I'll be asking everyone to contribute, be general or specific, because again, most people are quite happy to help when they're asked. And also looking at your priorities. What is the most important thing to you and your family, your friends over the holidays? Last year, most of us had a very different holiday season because we couldn't go or do anything. Things were smaller. We didn't see a lot of people. So is there anything that you learned from last year that you had to kind of change traditions, and are there things that you would like to keep this year? I've heard from a lot of people that was nice and quiet. They want to keep some of that peaceful quiet this year. And what might you like to bring back from the past or get rid of completely? And what would you like to say no to this year? And is there anything else you'd like to say yes to? So it's really about looking at priorities and what's really important. This is just a nice little graphic I found about the different pieces of a self-care plan or a wellness plan that I mentioned at the beginning. And just a few resources and support. So just looking at mental health support, to questions to ask yourself: if you're experiencing the symptoms of prolonged sadness and nervousness without improvement, is my mood interfering with my functioning at work and at home or in other areas of your life? Am I feeling less pleasure in my personal and professional life? These are flags that a doctor or mental health professional may need to assess and offer some additional support. Hope in terms of building resilience. Again, to ask yourself, what resources do you possess that help you manage holiday stress? Sometimes we've done things in the past to really manage it and we sort of forget about them, or they kind of fall by the wayside. What small changes can you make that can help manage your stress? And is there anything that I've talked about tonight, even one thing that you may try to implement? Next steps, just in terms of finding mental health support, at times can be very challenging, especially right now. There's a very long wait list. But if you feel like you or someone you care about may need additional support, please feel free to contact me. I can help you navigate the system or provide guidance on how and where to get support. I'm quite happy to do that because it can be a little overwhelming. Just a few other support. Lupus Canada website is excellent. Your family doctor, CAMH website is excellent as well. Lots of resources there. And here are 3 places to actually find lists of various therapists. So on Psychology Today, the Canadian Art Therapy Association. Again, I have a little bit of a bent on that I'm an art therapist, but they have a whole listing of art therapists. And then the Ontario Association of Mental Health Professionals, again, listing of different clinicians that can be contacted. So just a final quote: when you can't control what's happening, challenge yourself to control the way you respond to what's happening. That is where your power lies. And that's my contact information. So any questions now? I'd be happy to try to answer.
Thank you, Janice, for the presentation. We have one question so far from Dave, who asked, how would you deal with waking up from a stressful dream?
Oh, like in the middle of the night, I guess.
Mm-hmm.
Yeah, I think really doing the breathing, visualizing that calm place, having some water, even just walking around the house for 5 or 10 minutes and trying to go back to sleep. But it really is, when you wake up from a stressful dream, that amygdala has been triggered. So whether you're awake or not, it's telling you you're in danger. And the key is to get that amygdala in the brain calm, so that the breathing, put on some nature music, put on a little bit of music, anything that's going to get that level down.
Okay.
So it's the same strategies, I think, whether you're awake or not. It's a good question.
They said it was wake up in the morning from a stressful dream, not in the middle of the night, but would you recommend sort of the same thing?
Same thing, yeah.
Perfect. While we wait for other questions to come in, just want to let everyone know that we have about 15 minutes remaining if we get more questions. And we also are recording the webinar, and it'll be available on our website within 24 to 48 hours. Should you miss any of the slides, if you wanted to share the information with friends and family, it's a great resource to go back to. It's a lot to take in at once. So please feel free to go back and check it out again.
And I went quite quickly through. So
Pardon?
I went quite quickly through everything to get it all done. So yeah.
No, it was great. I think that sometimes people come back and they're immediately and they ask if the webinar will be available, because it's so much for them to take in while they're learning. So we're pleased to be able to share it after.
Great. Yeah.
I don't think, well, still nothing, but yeah, as well, we do have our newsletters, monthly e-newsletters available for anyone who wants to subscribe. We try to share new information, new articles, research updates, things happening at Lupus Canada. It's a great little online community we have, as well as our social media. We have Twitter, Facebook, Instagram, YouTube. We try to post daily on so to try to reach out to our community. And yeah, I don't know if Leanne, if you have anything you would like to, so actually we have a question. What is your go-to de-stressor, Janice? If you would like to answer.
Sure. I do a lot of meditation. I do yoga and I do art. Those would be my top three. And everyone really, it's a great question because everyone needs to find their own things. That's why I tried to include a lot of variety in terms of what helps reduce stress, because everyone will be different. Some people go for a run. You couldn't pay me to go for a run, right? So it's very personal. Yeah, those would be my top three.
She's also asked what our de-stressors are. Leanne, if you'd like to answer. I think mine is going for walks with my dog. I love it.
Yeah, I would tend to agree with that too. I find I have 2 dogs and I find they're a great de-stressor. Take your mind off sort of what's going on around you and kind of simplify things. Getting out in the fresh air, I find that's really invigorating. I know we can be sitting at our desks for too long. We're stuck inside a lot. So it's important to remember to get outside.
Absolutely. We have a question. What are the different forms of EMDR?
There are different forms. EMDR is a type of therapy. So it's EMDR therapy, and it stands for eye movement, desensitization, and reprocessing. And in a nutshell, it's a type of therapy that really addresses the thoughts, the feelings, and where trauma is in our body for past trauma. So it's a very efficient way to get at trauma without talking and talking and talking and talking, because it addresses the body, and we know that trauma is in the body. So it's a really, it's a very efficient, very effective way to deal with trauma.
Perfect. Thank you.
I could do a whole hour just on that. So,
so someone's asked, any tips for someone recently diagnosed? I don't know if you'll be able to specifically address that. I don't know if Leanne, if you both want to maybe answer that together in a way.
Yeah, maybe the person could clarify a little bit. Tips from what perspective? Is it dealing with the recent diagnosis and dealing with understanding it? Or maybe they could be a little bit more specific so that we can address it properly for them.
Yeah, for sure. I'll wait a few minutes to see if she would like to sort of address the question again. Okay. Dealing with a recent diagnosis. Yeah. So I'm assuming it is, yeah, lupus and not like a mental health.
Mental health. Yeah.
So dealing with a recent diagnosis, as far as understanding it, it's quite an open question, but we'd love to address it. But maybe if she'd like to contact us at the office or by email, I'd be happy to sort of walk her through some ways in which she can deal with the recent diagnosis and some information that we can provide to her.
Perfect. Yeah. So our phone number and email and everything can be found on our website. If you'd like to email us or call us after. We do have oh, sorry, a few questions are coming in. So I saw and appreciate the slides of possible questions to use in conversations, but how do you handle difficult or tactless relatives who show up over the holidays?
That's a tricky one to answer, because I would want much more information on what the dynamic is, what the history is between people. I think, again, you want to look at what part of it you can control and what part you really can't control. Whether it's bordering on abusive, all those things are kind of important things. I wouldn't want to just say you should do this.
Yeah.
So that's a little bit more of a complicated answer.
And I think you kind of made a point to say before whether, your priorities may be different this year, and, what you would want to say yes to, what you want to say no to. So maybe they could go back after and look at that. Do you have any advice for dealing with groups of vaccinated and unvaccinated relatives for holiday get-togethers?
Well, again, I think it comes down to priorities, right? And really belief systems. So if you want to stay healthy and you only want to be around vaccinated people, then you declare that. And then there may be consequences to that where you don't see certain people, or you see them outside, or you see them through Zoom. So I think, again, it comes down to what's important and then sticking to that and figuring that out and communicating it.
Yes, yeah, for sure.
That's another hard one that's come up a lot. It's dividing people. I have clients, same situation, where it's really dividing families because some people are not vaccinated, some people are. What do we do about that? So yeah, it's a hard one to navigate.
And Janice, would you say too, advice would be, sort of do what you feel is best for yourself, and take that don't worry so much about how you're going to make other people feel, but it's taking that power back to yourself.
Absolutely. Yourself and your immediate family, if you're on your own, that's one, but if you're living with other people, what's important, it is important for you to take care of yourself. So what does that look like? And then communicating that to other people. Absolutely.
Perfect. So this is a specific question. I don't know if we'll be able to get to fully answer it, but someone has asked, can taking lupus drugs have a mental health side effect? I'm taking hydrochloroquine.
That was good.
Thank you.
I wouldn't catch that because I'm not a medical doctor. That would definitely be a question though for your physician or a pharmacist, because the pharmacists are so knowledgeable about what side effects, etc. But I'm not qualified to comment on that.
Yeah, 100%.
But it's something to consider.
Yeah,
for sure.
And then someone has asked, for those who have pets, are you the sole caregiver? I'm not too sure if that was addressed to like a certain person or the other people in the webinar. So that's the other one we have. And then there was a second part, to stifle your emotion in the moment. I'm not too sure I understand.
She might be referencing that sometimes when you have animals, they can help with your emotional capacity in some ways. I don't know. I'm not an expert in this field. I'm talking from personal experience, just having dogs myself. I don't know, Janice, do you have anything you could add to that with having pets? Do they help with mental health or?
Oh, absolutely. I actually wrote it down to add it in because it is pets are a huge stress reducer. There's actually studies that show petting a dog, petting a cat, petting a rabbit, all of that actually reduces the amount of cortisol that's put out into the body. So it definitely has an impact. Even, we have all these therapy dogs now, equine therapy, like it's huge, the positive impact that pets can have for people. Absolutely. Yeah.
So to add on to that, they said, I think I would like a pet, but I live alone and wonder what would happen in a bad joint flare day that limits me remarkably. Yeah, it's tough, but I think, so many people, like you said, do have therapy and support dogs.
Yeah. And if you're thinking about getting a pet, those are sort of some of the things you want to take into consideration if you're on your own. Look at the type of animal that doesn't require a lot of care themselves. Like a dog needs to be walked, a cat doesn't. Yeah.
Even different breeds, I'm sure, of dogs. Some need much more physical activity than others, which would be
very true. Yeah.
Someone has commented saying that they cuddle up with my pets cuddle up when they have a flare. So
Ooh.
we did actually do on social media about a year ago. We asked people who are impacted by lupus or who are living with lupus to share their support animals, and so many people actually replied, sent pictures of
Oh,
their pets, and
excellent.
yeah, it was really great to see. I think they do sort of help with the
They
mental.
do, absolutely, they do. Yeah,
Mhm,
yeah.
mhm.
So that's all we have right now. I don't know, Leanne, if you wanted to add anything or.
I think that we've had some fantastic questions. I think, like you addressed, Ariana, lots of fabulous information, Janice. As usual, you provide lots of information for us to take away and really think about. So I really thank you for doing that. Fantastic presentation. Thank you to all of those who have attended. As Ariana mentioned, this webinar is being recorded and will be available on our website within 24 to 48 hours. So please feel free to go and revisit it, share it with your family and friends, colleagues, whoever you'd like, because sometimes looking at things a couple of times, you may take something different from it and be able to sort of digest some of the information that Janice has provided. If we have no other questions tonight, I think we could end it there. We're almost at 8 o'clock. I'd like to thank you, Janice, once again for participating.
Thank you, Leanne. Thank you for inviting me.
Absolutely. Thank you, Ariana, for moderating. And I want to wish everybody a very happy and safe holiday season. And we look forward to seeing everybody in the new year.
Right.
Yes, bye.
Take care. Bye-bye.
Take care.